Good health means different things to different people, and its meaning varies according to an individual, community expectation, and context. Many people consider themselves healthy if they are free of a disease or disability. However, people living with a lifelong disease or disability also consider themselves in good health if they can manage their condition so that they do not impact greatly on their quality of life. Good morning, good afternoon, good evening from wherever you're watching us from. Welcome to Living and Thriving with Lupus, brought to you by Lupus Foundation of Africa. Now let's talk about lupus. Systematic lupus erythematosus, or simply lupus, is an autoimmune condition that develops when the immune system attacks rather than defends the healthy cells of the body. Lupus can affect many parts of one's life and body. This can be the lungs, the kidneys, the skin, the blood and vessels, the central nervous system, the heart and lungs. So let's talk about the symptoms of lupus. Lupus can be difficult to diagnose because its symptoms and signs resemble that of other. The most common ailment is arthritis. These symptoms can vary from one person to another or can overlap due to another disease. Lupus can be difficult to diagnose because its signs and symptoms resemble that of other. The most common ailment is arthritis. These symptoms vary from one person to another and may change over time or overlap with other diseases. The most distinctive sign of lupus is a facial rash that appears on the cheeks, resembling the wings of a butterfly and folding. However, this is not a universal sign. Some of the other signs of the disease are pain, swelling in the joints, muscle pain, unexpected fever, chest pain when taking deep breaths, dry eyes, oral ulcers, headaches, confusion and memory loss, hair loss, and constant fatigue with no apparent reason. Lupus is a lifelong or chronic disease that flares unpredictably, with sudden attacks that can cause inflammation and pain, which can over time cause the deterioration of healthy organ function. Lupus flare occur when signs and symptoms get worse over a period of time, or improve, or even completely disappear over time. Despite a lack of known cure, modern therapies aim to improve the quality of life of the people living with the disease. You can take steps to control the symptom, prevent flare-ups, and learn to cope with the challenges of lupus. So let's talk about the medication used to treat lupus. The medication commonly used to control lupus include immunosuppressants such as azathioprine, mycophenolate, methotrexate, etc. Others are over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen for pain, swelling and fever, antimalarial drugs such as hydroxychloroquine, commonly known as HCQs, to reduce flares, prednisone, and other types of corticosteroids can counter the inflammation of lupus. We also have biologics administered intravenously like rituximab and belimumab, benlysta, another name, to help reduce symptoms. We will speak more about this medication and their side effects in our next video. How do you keep lupus under control? The proven way to keep lupus under control is by adhering to one's treatment and taking care of oneself. It is important to learn to show when the flare is coming, see your doctors regularly. Sun protection, this is by sunscreen or wearing a cape or wearing long-sleeved clothes. Sleep and rest are crucial. Dietary changes. And lastly, build a support system made up of people you can trust and go for help. So now let's talk about the Lupus Foundation of Africa. This is a non-governmental organization based in Nairobi, Kenya, whose goals are to create and increase public and professional awareness of lupus, as well as offering a network of support to the people living with the disease. These include material and emotional support. We have a member of over 300 active members with chapters in cities in Kenya like Nairobi, Kisumu, Mombasa, Taita Taveta, etc. etc. We also have a virtual network across East Africa. We have a community of warriors, and we're willing to expand that community so that we can emphasize on the accessible diagnosis, the value of accessible diagnosis, treatment choices, all the while lowering the disease stigma and also creating awareness. We invite you to our journey of learning about lupus to better support the people living with the disease, because people living with lupus are capable of living long lives and healthy lives. Remember to share, like, subscribe to our YouTube channel as we learn more on informative and insightful things about lupus. I've been your host, Erythematosus.